Thank you for the warm introduction. Good afternoon. We are approaching towards good evening. And my topic of presentation is incorporating hahnemannian principles in the practice of telehomeopathy, current scenario and future possibilities. The presentation is dedicated to these masters because of whom I am in front of you. They had a large share in making of what I am today. The presentation will have objectives, cases, take-home message, conclusive learning, master table and annexure, where we are going to understand the conceptual process, how processes can help in analysis and evaluation of a case. The objective of today's presentation is learning how a registered homeopathic practitioner utilizes telemedicine application by incorporating hahnemannian principles and discovers its scope in homeopathic management of varied diseases in epidemic and pandemic situations. This will be an illustration of how guidelines that has been released from time to time by the government. The first case, 40 years old businessman from Marwadi community. He is under homeopathic treatment for chronic allergic rhinitis, and the constitutional remedy that I had prescribed is calcarea carb 200 single dose weekly. He called up and implied as below. The interview opening, I am trying to cover multiple concepts. Hello doctor, one new case has been found in my next colony. So the relevant points from the history are fear of contracting COVID-19 disease, anxious about his 6 months old son, worried about what will happen if the family contract the disease. Anxiety is felt in chest and around chest. 2 to 3 loose motions he had in small quantities with generalized weakness and exhausted feeling. Application of theory into practice. Now aphorism 86 says that you have to elicit more precise information. So the knowledge of organ and case taking skills will definitely help us in understanding the problem. So I asked, have you taken Arsal? Yes, doctor, 3 days back only I had taken it. Our Maheshwari community had distributed arsenic. So why I had asked this question? Earlier also it was known to us that it is a free distribution of arsenic album was there, unnecessary repetitions were there, over the counter availability, unnecessary repetition and due to anxiety and the panic state. So when we have a patient evaluation, so causation is history of Arsal 30 consumption, day 4, it might be suggestive of proving susceptible to contract disease, that may be the perception, and the evolution is soric where we are able to find out the sudden onset pathology of functional nature and the expressions at emotional level are also seen. So I just went into understanding the acute state of apprehension. After repertorization, whatever symptoms I had just mentioned, they were in the totality and it covered arsenic as the first remedy. So again, I referred Douglas Borland in British Journal of Homeopathy through the Homeopath software, where it says that not only fear for themselves, but for everyone connected with them. That is the key. Ars impulses come under stress. So I also come to a conclusion that stress is there, and because of that stress, he is showing these symptoms and the consumption of Arsal is also there. So on that basis, I studied the remedy relationship, and we are aware that Nux vomica, arsenic album is having close relationship with Nux vomica as well as calcarea and camphor. So I felt that I should antidote this case. So differentiation between Nux and camphor was given and Nux vomica was prescribed. The lectures on homeopathic philosophy by Kent says that the physician should carefully restudy that they may be brought again to the mind of the physician. Follow-up consult, all complaints were relieved, and the demonstration, it demonstrated how history can be taken through telehomeopathy, problem definition, problem resolution, interview plan, and the different components of interview in terms of opening, body, conclusion, and the remedy response evaluation. The second caselet talks about 40 years of old female complaining of cough from the throat pit since 5 to 6 days and aggravation at day and night. Non-productive type of cough was there, dryness of throat with mild increase in thirst, whereas the history is there of taking anti-allergic and antitussive from dentist's husband, which is partially ameliorated. Relevant points from the history, husband is a dentist and since last week he is attending his patients, and the husband's risk of exposure to COVID-19 and its final outcome of that he may contract the disease. What will happen to me and my family insisting her husband to avoid going to clinic, but he is not listening, also feels if husband will not work, then how daily needs will be fulfilled. The conflict was seen in terms of approach avoidance conflict, because fulfilling daily needs and don't want to husband to attend her clinic. The psychogenic cough as a query diagnosis, because it was not fully developed. So that was the thing. And on repertorization, it was observed that phosphorus and arsenic, again both two remedies are coming closely, and phosphorus 1 m TDS for 3 days was given. Complaints were better, patient restored to health, she supported husband for his medical services in such kind of pandemic. Another emergency case was seen, it is a surgical case, and we can see the father, informant is father, mother observed sudden swelling of penis and dribbling of urine. Patient was shown to pediatrician, but the complaints were status quo, as patient had regurgitated all medicines, and in the middle of night, the abdominal distension was more. So father sent me a message on WhatsApp at 1:42 a.m. and then he called up at 1:45 a.m. The transactional record, which is a translation of Marathi communication, there was swelling of penis and not able to pass urine, offensive urine is there, fever was there, fever of moderate degree, and patient was comfortable, the child was very comfortable. Edema of the penile shaft as the diagnosis. Now, subjective level, mental and physical, we can see, and the moderate level of pathology, where subjective distress is there, suppression of discharges, and poor response is there. So the therapeutic planning was made in terms of giving treatment and instant relief to restrict the pathological progression. Repertorization was again done. I am skipping certain parts because of time limitations. So Merck salt was the first indicated remedy. I just requested him, please come to my home and collect the medicine at bedtime. It is available at my home. So he collected medicine and follow-up was given at 8 a.m. In that, he said that at 3 a.m. we had given medicine and within 45 minutes he passed urine with some mucus. Then he slept and I advised that to continue the treatment. Evidence is also available. Swelling was reduced, urine flow was normal, urine color was yellow, no odor was there and fever was absent. So he was restored to normal. These are the complex of cases where the family as a whole was affected because of the threat of being contracting COVID-19. So the first person, he was a MBBS DNB pediatrician. He communicated me, initiated communication for treatment. The wife is gynecologist, and he said that we had come in contact of a COVID positive case and our hospital is in containment zone. 3 minutes are still left. I had set up a starter, time stopper. So, sorry for that, but I am also in tune with time. So dryness, he said that dryness is there, and as per the guidelines, Bryonia, Merxol, Rustox 200 and Camphor 1 m was prescribed. Another case, so I will just skip this case part. This is the master table that I had made throughout what cases are there. So the telecommunication applications what were used, then the teleconsultation process, type of consent, type of consult, timing of info transmitted, diagnosis, provisional diagnosis. So all of you might be doing all these things, but what processes we are using and what are the guidelines that are given, whether we are following that and in what way it can help us in giving a qualitative as well as standardized homeopathic treatment which can be demonstrated effectively. So the conclusion is Ayush telemedicine practice guidelines in homeopathy can be effectively applied in the COVID-19 pandemic. It helps prevent the spread of disease and aborts disease progression from mild to severe, irrespective of comorbidities and the nature of disease, emergency or non-emergency. Adhering to these principles and the effective demonstration through case-based learning will definitely enhance our qualitative services to the society. Further studies are definitely needed, and the working model that throughout the cases has been seen are the observations. Observations are very crucial. They are part of our process of learning in terms of understanding what facts are given in the homeopathic Matra Medica, what kind of experience we are daily getting in our standardized homeopathic practice, and the correlations that we are about to make in terms of clinico-pathologic concepts, psychopathologic concepts, and it is a process that is continuous. It is a continuous learning phenomena in view of extension of our knowledge levels at track for the purpose of serving tri-coordinate care, that is the learner care, knowledge care, patient care, and the learner care. It is beautifully explained in Dr. M.L. Dhawale sir's symposium volume. These are the guidelines you can refer. This is the flow chart in what way we can manage cases. All of you or all of us are managing cases, but what we are doing, how we are doing, it can be very well demonstrated and understood from these things. Okay, the paper has been already published in Journal of Integrated Standardized Homeopathy by Dr. M.L. Dhawale Memorial Homeopathic Trust. You can refer that. Another set of 10 cases has been published in National Journal of Homeopathy, and I am proud to say that I am a reviewer of GISH journal. I am associate editor of NGH as well as I am associate editor of Homeopathic Heritage. If any questions are there, you can communicate me later, or you can search for the material that is already there, and the same presentation will be coming up in Mission Success in very few days. Thank you for your patience listening and finishing within the time. I am glad to have my teacher, Patil sir, JD Patil sir, who has taught me repertory, and I think that I had covered the repertory part in a much better way. My principal, P.Y. Kulkarni sir, I am alumni of Foster Development's Homeopathic Medical College. I am guest faculty, so Desarda madam, Desarda sir, and again Vasantrao Kale team, students are along with me. So, and the alma mater Dr. M.L. Dhawale Memorial Homeopathic Institute, because of that it is not possible to achieve such type of great height, because I had written 103 articles and I had in various positions right now because of the grace and what teaching they had given, and family members, Hamai organizers, especially Bhasme sir, he always promote me, and the learners, thank you. Learners are the best. Because of them, it is not possible. Continuous learning is impossible. Without that, we have to cross-check with the learners whether I am teaching it in a right way or not. Thank you very much once again.
Thank you very much, Dr. Yogesh. Now, I call